At the National Economic Council held on the 22nd of March 2018, Bill Gates in his speech said that the Nigerian primary health system is broken. Earlier in January, the Guardian newspaper reports that many Nigerians still pay out of their pockets for medical expenses, a retrogressive healthcare funding mechanism. On a more clearer analysis, a 2015 WHO data states that 70.3% of health expenses in Nigeria are made out of pockets, whereas in South Africa, the figure is 7.7%. Nigeria budgeted 340.5 billion naira for health in 2018, a meager 3.9% of the total budget. And today we will be asking Nigerians how they rate the public health system in the country. From the famous Otigba Junction in Enugu, welcome to Health District Africana. I am GILLIAN Sinclair.
It's laughable. Public health system in Nigeria is too poor, totally too poor.
It's a pity you have to rate them 0%.
Unfortunately, in Nigeria, the state of our health system is abysmally poor, given our population.
I see nothing good about the public health system in Nigeria.
I really want to be honest about it. When you talk about health system in Nigeria, I hope you're not talking about concentrating yourself within the urban areas. You know, if you're talking about health system, you should also extend whatever you want to grade to the rural areas.
A number of things are not going well. And first, I'll start with the attitude of the health workers. Okay. There's this almighty attitude that some doctors move around with, and it's not nice for the patients. You know, people are dying, and some health workers will be showing some really irritable attitude. Okay. You know, if you have problems within the sector, you sort it out, but once you're dealing with a patient, it becomes a life and death matter.
We have the manpower, but unfortunately our leaders have not been doing much. Okay. That is why they prefer going to abroad to treat themselves anytime they are ill. So our hospitals, our public health system is better described as mere consulting clinics.
But of course you do know that part of the reason is that we've witnessed very poor leadership in our country, poor governance, a situation where those who are occupying high positions in government seem not to understand that health is wealth, and to that, but I do not blame them, because majority of them do not go to government hospitals. When they are sick, even our president himself had traveled outside Nigeria more than anybody in the country, if I must say, and to that extent they believe that the best health services can be acquired when they travel abroad, leaving Nigerians to suffer and die.
As you can say, if you go to so many hospitals, you can see poor management, not taking good care of patients, no equipment. Even if the approach from doctors, those people that are in unconsciousness will die immediately, because the way doctors approach to their patient is so poor.
If you visit the hospital, you will see by themselves. There's no qualified medical personnel. Most of the times you go, they will not see no medicine to attend to the patients. So I don't see anything good to them. For me, I will rate them 0%.
And then they're always having strikes, industrial actions. If it's not JUHESU, it's the NMA. There's always something happening in the health sector. People are always trying to move to the next rank, but no one is trying to push the boundaries of medicine. Nobody is really losing sleep over the best research on how we can stop malaria in this country, how we can sort out the ravaging typhoid fever in the country, how we can sort out small infections that are affecting people. The people in the health sector are not doing that.
But what I've come to notice is that when you talk about health system being what it should be, the standard it should be, you see that within the urban areas. But when you go back to the villages, you see the opposite of it. So that's why I said 6. So if you are talking about rating, it should be encompassing. So for me, so long as those in the rural areas have not yet started getting what they should get as Nigerians. I can't say it is 100%. But if you are looking at it from the point of view of urban areas, yes, you can give it 88.
When you go, you do not see even electricity for those who want to perform operations, those who want to perform cesarean sections on pregnant people who have problem, and that's the reason why we have a lot of deaths that are avoidable. So the state of health in our country is very, very bad, and I hope that government could begin to take steps towards remedying it and showing concern for the living.
The way they manage emergency is also poor, because they must say you must donate this money, you must pay this amount before they can start treatment or before they can commence treatment, whereby if you cannot afford it, they will just dump your patient, they will just dump the person, and the person will be bleeding, shouting help, help, to the person die off. What I'm saying that it is not good, it's very, very bad. They have to provide some medical, as in they have to fix maybe drip so that the person can be able to be able to get him or herself before the main treatment can implement. Exactly.
Another thing is the remuneration. Well, the remuneration of health workers in this country isn't at par with other countries of the world, even some African countries. Say Egypt. Egypt has a very formidable health system, and just look at what's happening here. We're just answering giants of Africa, just in the word of mouth.
I think the best thing is, it's not as if things are not being given for those people in the rural areas to be taken care of. Sometimes those facilities are given, but they don't get to the people that are meant to make use of those facilities. So what I'm thinking is that we don't just stop at endorsing that those facilities be given to areas, mention the areas and all that. We should also ensure that those facilities are taken to those areas where they are necessarily needed. And in addition to making sure that they are taken there should be people that should monitor those things to make sure that those facilities are being used, and not that they are assigned to those people just by words of mouth, but those people that are supposed to make use of them are not actually making use of them, and you see that there will be an increased death rate, but that's not what it's supposed to be.
For me, the first thing to be done is there should be a law banning all these leaders going to abroad to treat themselves. They should be here, get treated here. I think that's the number one step to be taken, so that they can build state-of-art hospitals, equip them. Let all of us stay here and get treated.
We always like making comparisons with maybe Britain or America. So go there, get their template, implement it here. It's not hard. Our politicians are always traveling, they're always on the go. So I challenge them to implement the things they are seeing when they travel abroad. We can have it here. In Nigeria, we have the resources to replicate the kind of health system in the US and the kind of health system in Britain. But then one thing needs to happen. There should be health insurance. You start by having health insurance in place for those in the private sector, for those in public service, for the civil servants. That way, you have a huge chunk of the population captured in health insurance, and then people can easily pay for their health needs, and doctors wouldn't complain about their salaries.
That I think there's a need for them to think of what UNESCO minimal standards for health is, and begin to budget appropriately, and begin to think of how to develop partnership with international agencies, donor agencies, UNICEF, those that can even begin to organize training and retraining for doctors, pharmacists, and other key participants in the health sector. They need to begin to think of building new hospitals.
They should equip the hospitals.
Okay.
They should give training to doctors on how to approach their patients. They should make available of the necessary equipment they needed in the hospital, and they shouldn't allow any doctor to demand any ransom before they start implementing treatment on their patients.
They should build a good hospital, equip those hospitals with modern equipment. In addition, empower the qualified medical personnel and also pay them regularly so that they will do their job.
The National Center for Biotechnology Information, U.S. National Library of Medicine, states that public health care system can thrive, succeed, and be sustained if organizations and coalitions effectively address these 6 key areas, which are innovation, a rigorously established technical package, management, partnerships, communication, and political commitment. That's why a country as Norway often comes close to global quality of life rankings. The country is said to spend more per person on healthcare than any other country on earth. That's according to Business Insider. And that's a wrap on our episode today on Health District Africana on the Streets. For more health news, stories, and our details, kindly head over to our website www.healthafrique.com. Health District Africana is also on other social media platforms such as Facebook, Instagram, and a vibrant YouTube channel. It's been GILLIAN Sinclair, and until next time, stay healthy, stay safe.